Hi, I'm Dr. Beltre from Beltre Bariatrics. Today I'm going to talk about a topic, a question that a lot of my patients ask me. And this question is regarding excess skin. Am I going to have excess skin after the surgery? How much excess skin am I going to have? What can I do about it? So I figured I'd make a short video talking about excess skin after weight loss surgery. Well, believe it or not, first of all, not everyone gets excess skin after weight loss surgery. Okay, excess skin depends on several factors. Some of these factors you can control, and some factors you have no control over it. First of all, one of the main factors I find is the amount of weight loss. Okay, normally I've been doing this for over 20 years, and this is what I have noticed. Patients that need to lose 100 pounds or less, BMI is 40, the excess skin that you have is not that noticeable. And most patients are very happy with their skin and just using tight garments usually enough because excess skin is not that noticeable. However, patients that have lost 100 pounds plus, definitely you start to see excess skin there. So if 120, 150, obviously, or more, you're going to see excess skin. So the amount of weight loss is important. Therefore, your BMI that you're starting with is important, because if your BMI dictates that or says that you need to lose more than 100 pounds, then more likely than not, you will have excess skin. The other factor, which you have no control over it, is your gender. Males tend to do better, a little better compared to females when it comes to having excess skin. So if you have a male patient that had obesity surgery and you have a female patient that had obesity surgery and they both had the same surgery, they both lost 150 pounds and they are the same age, I find that the male tends to fare better, do a little better in terms of excess skin. This is less noticeable and so on. The other factor which you have no control over really, it's your age, right? I mean, needless to say, the younger you are, the better you will do in terms of your excess skin. Remember, underneath your skin, we have this collagen. Think of or the tissue underneath your skin like a rubber band. And if you have a healthy rubber band, you stretch it and you let it go, it goes back to its size that it started with. The younger your skin, the healthier it is, and therefore you are going to notice less excess skin if you're younger. Then, of course, genetics. I mean, there are people that just have good skin. It runs in their family. Doesn't matter the race. Runs in your family. I've seen women that can give multiple births and they still have good skin. They do well in terms of their skin, overstretching and so on. There are things, however, that you can do to help with your excess skin. At the end of the day, the skin is just an organ just like any other organ. Number one, stop smoking. First of all, if you don't smoke, it's even better for you in terms of the health of your skin and the excess skin. If you do smoke, you should consider stop smoking. Smoking affects every organ in our body, the microvascular or the small vessels in our body, and therefore also affects your skin and how healthy your skin looks. And you all know this. You notice these things. Also, stay well hydrated. Drinking plenty of water can keep your skin well hydrated and more plump, if you will, and therefore with more elasticity, and therefore will help you a lot in terms of how much excess skin you're going to have after massive weight loss. Exercising, right? Building muscle, engaging in strength training exercises can help build muscles, which can, of course, help fill loose skin and improve its appearance. There are other things, of course, that are very, very important. Your diet, right? Eating a nutrient-rich diet, consuming a balanced diet, rich in vitamins, minerals, proteins is very important. That can support the overall skin and health and promote tissue repair. Remember that our skin keeps regenerating. The older skin gets sloughed off, and then we have a new skin underneath. And for you to form good nude skin, you need to have the nutrition, the appropriate nutrition. So plenty of protein, and taking your multivitamins is very, very important. So these are the things that you can do to help you with the excess skin. And then, of course, sometimes excess skin can give you symptoms, dryness in between the folds, and so on. So applying moisturizers regularly can help keep the skin also hydrated, and may improve elasticity as well. There are other non-surgical options. So let's say you've done all this. You don't smoke, you exercise, you stay well hydrated, you eat healthy, you take your multivitamins. There are other things, non-surgical things that you can do to help with the excess skin. There are various non-surgical treatments available that may help improve the appearance of the loose skin, actually. So things like laser therapy, radio frequency treatment, which are designed to kind of tighten the collagen fibers or underneath the skin, or ultrasound therapy. Best thing to do is to consult with the dermatologist. Some dermatologists do these procedures because these are really minimally invasive or non-invasive procedures, really. Or plastic surgeons also to explore these options available to you. And then, of course, finally, there's surgery, right? Sometimes surgical procedure like body contouring or excess skin removal may be necessary to address a significant excess skin. I find that most of my patients end up going for the arms first, maybe because it's more noticeable. Arms, abdomen through a tummy tuck or body lift, and breast through either a breast lift with or without implants. These procedures, of course, should be discussed with a qualified plastic surgeon who has experience in working with patients who have undergone bariatric surgery. In fact, I know surgeons in the area that have done fellowships, right? They have done extra or a specialty in excess skin removal. There's such thing now. Plastic surgeons that have done a subspecialty in excess skin removal, and there are some in the area that I can refer you to as well. And of course, seeking support. Dealing with loose skin after bariatric surgery can be emotionally challenging sometimes, and we have support groups so the patients that are dealing with similar issues, they can support each other. So seek support from a healthcare professional, support groups, or counselors who can offer guidance and encouragement throughout the whole process. Remember, everyone is different. You can have two individuals that lost the same amount of weight, and one will have more excess skin than the other. What works for one person might not work for another. So it's essential to find a strategy that works best for you, and to be patient and to be kind to yourself. I mean, after all, you lost all this weight, you're healthier, you've done really well. This is just another small challenge. I would not even say it's a large challenge. It's something that needs to be dealt with. But there's many different ways of dealing with, and we do have ways to address it. Again, I'm Dr. Beltre from Beltre Bariatrics. I am a bariatric surgeon in the area of Orlando, Florida. And these are questions that my patients normally ask me, and I figure let me make a short video addressing this issue. I hope this was of help to you. Stay healthy. Thank you.